And good morning. It is 18 minutes after 9 o'clock. And joining us in studio from Lovelace, I always say regional hospital, but just Lovelace Medical Group, I guess you could technically call it. Because you're actually up the street here. You're not in the hospital itself, right? If
That's correct.
Very good. But
Yes,
joining
sir.
us, and I'm just conversing without introducing everybody. Joining us in studio is Dr. Peter Jewell. He's a family practice physician with Lovelace. Good morning, sir. How are you doing today?
Good morning to you. Excellent, actually.
Awesome. Well,
Doing good.
Well, first, thank you for spending time with us. I know, much like yourself and all the other medical providers, your time is you're usually getting pushed from one place to another pretty much 24/7 until it's time to punch the clock and go home. So I do appreciate you spending some time with us today.
You are absolutely correct. A couple things I'd say about that. I've been here in Roswell for about 13 years now. Did residency here, and I have a commitment. I told all of my patients from the get-go that I would be here until I retired, and that's kind of my goal.
Okay. So where are you from originally, if you don't mind me asking?
Everybody asks me that.
Yeah.
Okay, that's a long story.
Okay.
Born in Wilmington, North Carolina, so
Okay.
on the coast. Grew up in what I call the Chicagoland metropolitan area.
Okay.
But that's a caveat to that. I would say that where I lived was about the same distance that we are here from Albuquerque, from Chicago.
Got you. So it wasn't the suburbs. You were a little
No.
more in the state.
Yeah, so, small town. In fact, the town that I grew up in, 7,000 people where I grew up there, that's what drew me to
Gotcha.
small town medicine.
Sure.
That's what I had always envisioned myself when I became a physician, that's what I would do.
Gotcha. So you've got a little bit of experience in all, various parts of the country here.
Oh,
and
well,
things
that's-
like that. Or
Not done.
yeah. But wait, there's more.
Yeah, in 1991, I moved to Colorado. I was there for 20 years, and then I've been here in Roswell for 13. I did residency here through the residency program that was at Eastern for a while.
Okay.
It was a 1+2 program. First year was at UNM
Okay.
in Albuquerque. Next 2 years were here.
Gotcha. So not only, you've experienced, but you've got, some of your actual training was done right here in New Mexico too.
Yes,
So,
sir.
awesome. Good
Yes,
deal.
sir. Yep.
So like you said, you've been here about 13 years in Roswell, I guess you could say.
Yes, sir.
Now, as far as the Southwest goes, are you've embraced it now, or do you? 'Cause
Absolutely.
I grew up in D.C., Maryland area, so I know what you're. It's a bit of a culture shock the first time you come to this area, and you're not accustomed to that. It takes time. Just as the environment, it's not supposed to be hot all the time. It's not, you know what I mean? It's just it's a different environment than other parts of the country. It just is.
It's not hot all the time. Remember Goliath? Come on.
This is true. We did have a few of those, but it's just I just remember, like, for me, I came from via military, so I was stationed at Holloman and Alamogordo there, but I remember, and they flew into El Paso. That's where they flew me into, and I was what, 20s, early 20s. I was a kid. And I'll never forget when I flew and I was looking as we're flying at El Paso, and I look out that window and all I see is brown. And I'm like, what am I getting into? And well, here, 30 years later, here I am married and happy and loved in this place. But first time not knowing, it can be a bit of a shock to you.
Well, what I'll say is I'm kind of an outdoorsy person, and this is a good place for that.
Yeah, absolutely. Yeah, you can go an hour and it's a different. We were just talking about that last hour with Natasha. You go an hour away and you're in the mountains and it's a way different universe than here. So
Absolutely.
the beauty of New Mexico.
Yeah. So I have, no want or need to move to a big city.
Gotcha.
Going through med school, et cetera, I lived in a lot of the big cities and I don't want to go back there.
Well, and let me ask you this, because especially as a family practice physician here, which in essence is kind of that front door of medicine where generally when people have an issue, most people, they'll go see their family doctor first. And then if they need to go to a specialist from there, that's where you take over and decide that. But you kind of have to be a jack of all trades when it comes to that. You gotta be an expert or very knowledgeable in all facets of medicine. You don't get to hone in on one specialty here. But when you also are more a rural doctor, you kind of have that same. Even if you're a specialized person, your specialty is like, okay, you're a heart. oh, you don't do just valve. You got to do everything with the heart. You know what I
Yes,
mean?
sir.
Whereas in Chicago or New York, they have a guy that all they're doing is bypasses all day or something. You know what I mean? So in essence, I imagine as a doctor, it's probably a little more fun this way because you get to see more, do more versus the guy that's just coming in and doing brake jobs all day and then going home. You know what I mean?
I think honestly, when I first went to med school, I was thinking I'd become a surgeon because surgery is actually, I guess, that's the glamour when it comes to medicine. But when I did my first rotation in med school for surgery, standing in the same place for 4 hours, I couldn't walk at the end of the day. My back was just done.
Gotcha.
And then the first time that I really felt like a doctor in med school was when I did family practice.
Gotcha.
And it was kind of a nice variety because one patient I'm seeing, because I do OB-GYN things as well too.
Gotcha.
One patient I'm doing a pap smear, and the next patient I'm talking about diabetes. The next patient I'm talking about hypertension. Next thing I'm doing is a procedure. And with that, it kind of keeps it refreshing. Keeps it fun, basically.
Absolutely.
So,
now, obviously, with your practice here, you're seeing all your patients, your family, and you, like I said, you run the gamut. Kids, women. You do as the family practice medicine. You're the doctor that. So if your kid needs a physical for sports, or needs or has an earache, or you yourself not feeling well and need to get help. That's your specialty. You're the one who's got to see it all and then make the determination whether you need a specialist or you can take care of it here or whatever needs to happen next.
Yes, sir. I pretty much do everything. Couple of exceptions. I see 1 year old and up.
Okay.
So once you turn one, from then on, I'll see you.
You got them. If it's an infant, go to your pediatrician. But once they turn one, come see Dr. Jewell. We can bring them into the family fold.
Absolutely. And the big reason behind that is because I've kind of lost a skill set with circumcisions.
Okay.
It's been 13 years since I've done one, and I don't really think that would be wise for me to re-up and do that again.
I don't know. I don't know how the procedure works, but I feel like if I'm getting a circumcision, I want a young man's game with good vision.
Thank you. Yeah, exactly. No, I feel the exact same way. And it's just one of those skill sets that if you haven't done it for a while, it's not really that difficult of a procedure. Mm-hmm. But since I haven't done it since I was a resident, I just don't think I should do that again.
Sure. And this is where I'm naive. Is that a procedure that happens at the delivery sometimes, or is that always later?
It can be.
Okay.
It depends on the family's choice. Sometimes they're not sure that they want to do it or not.
Gotcha. And then you can.
Yeah.
If you need to buy time to think about it, then you'll see the family medicine or the expert on that too.
Absolutely.
But if you know, maybe just a tip, just pardon the pun.
That's a good one. I like that.
Pardon the pun. Just a tip. Maybe have that conversation before the birth and maybe come with a decision one way or another.
I agree.
You do have 9 months to figure it out, or not 9 months, but depending on when you just find the sex out.
Exactly.
7 to 6 months. I don't know how soon they find out, but 6-7 months, you'll know. But anyway, I do want to talk COVID a little bit because obviously that's the topic here. I've been saying on this show, and I preach this mantra every time. I know we live in a confusing world right now. 1 minute you got people telling you do this, the next minute don't do this, do that, don't do this. You've got politicians telling you what to do. You've got Facebook people just telling you what to do. I've always told people, if you have questions about one way or the other about the vaccine, whether you should get it, should not get it, why is everybody concerned about it, the one place I think every person should go first before you get on internet or listen to politician X or any of this mess is your doctor. The same person you take your kids to, you take yourself to, anytime you have any other medical question or issue, you call the doctor. That's the person who's trained, who's the expert on these types of things. So,
as a family care
practicer here, you're the expert as far as I'm concerned. You're the person that if people want to know if they should get this shot or not, they're the type of person they need to talk to here. So let me ask you, what are you telling your patients about the COVID vaccine right now? When they're asking you about it, what information are you giving them?
So let's start at the beginning because you mentioned a couple things, and I kind of want to touch on a couple points there.
Absolutely.
unfortunately, this did become a political issue.
Yeah.
And if we could reverse time, if there was such a thing as a time machine,
Yeah.
I wish we could go back to that time and approach COVID when it first started a little bit differently. The people need information, and what it should have started with is say, look, science changes. This is a virus that never infected human beings before. Never. This
Gotcha.
was in bats. Okay.
And that's why it's alarming is it jumped.
Yes.
I gotcha.
And viruses, to kind of explain briefly how a virus works, it comes into your body in a sphere. That sphere opens up. Its DNA tricks your own DNA into making more copies of itself.
Okay.
And the reason why, when the vaccine was first produced, it was so effective, because back at that time, 95% effective at controlling the first strain of COVID that was in the United States. We're not with the first strain anymore. Now we've got the Delta variant. There's a Mu variant. There's a Lambda variant. There's this variant.
I feel like there's like 3 or 4 on the horizon coming too. Yeah.
Yeah, absolutely. And the reason why that is because, as I was saying before, the virus tricks your DNA into making copies of itself, right? Our DNA is not perfect. That's why some people have brown eyes, some people have blue eyes, some people have blonde hair, some people have brown hair, right?
Why someone likes coffee and why someone doesn't. Yeah.
Exactly. So when you figure that there's been how many millions of people that have had this virus, the virus that I have, and then give to you, and then give to the next person, to the next person, to the next person, it changes in each person, right?
Gotcha. Okay.
So that is why it's hard to nail down a vaccine that's going to be 100% effective 100% of the time.
Because you're trying to make a cookie cutter thing for something that's anything but cookie cutter.
Absolutely.
Got you. Okay.
Absolutely. So right now, the statistics change every time I read about it. The most recent one that I read about, or the most recent statistic that I read about just last night, 80% effective towards the Delta variant.
Okay.
The problem is, people focus on, yes, there are people that have had the vaccine that are being hospitalized. That's the truth. Okay. That's the truth. Number one, most of those people, not all, but most of the people are 65 and above.
Gotcha.
Okay. So they're the highest risk factor to begin with. Then you got to throw in your diabetics, which I am. You have to throw in people that are on chemo, people that have HIV, et cetera, et cetera, et cetera.
Anything that basically weakens the immune system.
Absolutely. Bingo.
Gotcha.
Yes, sir. So that's why these people are getting this after they've been vaccinated. And nobody talks about this in the media. The media's done a very poor job explaining what's really going on.
Gotcha.
And also talking about that time machine, back to the beginning when I was talking about this, science changes. Again, since it was never in a human being before, things change. New research comes in. Oh, wow, we didn't think about that, right? We know that about almost every disease state. What we know about polio today is a lot different than what we knew about it back in the 40s.
Sure, yeah.
Okay. Same thing with HIV. These viruses change with time, and unfortunately, we can't keep up as of yet.
Yeah.
And that goes back to the whole. Let's go back to politics. I'm pretty conservative when it comes to politics.
Sure.
However, I don't toe the party line when it comes to the vaccine.
Gotcha. You're following the science.
Yes, absolutely. But unfortunately, the science changes.
Absolutely. Well,
so that's kind of what I'm trying to say.
I kind of, and I've mentioned this before, and if you sit back just for a minute and think about the last 2 years, just sit and think about what we did. And basically, like you said, we came across a virus that was not a part of humans until 2 years ago, whenever this thing went down.
Yes, sir.
And now today, less than 2 years later, we have a vaccine for it.
Yes.
And I don't know enough to know on how medicines are made. I know it's a process. I know it's long, but for us to basically have something that we didn't know was possible, to having now something that can to mitigate it, in 2 years, that's a Herculean effort.
I've got some explanations to that, and people probably.
It's a good thing. It's a good thing. I'm like, that's a tip of the cap to human technology, as far as I'm concerned.
So, couple of things that again, I was talking about how the media doesn't really, express the right way of how we came up with the vaccine, et cetera. Honestly, messenger RNA vaccines have been in the works for 20 plus years. Okay. Now, when you look at pharmaceutical companies, they make very, very little money on antibiotics, antivirals.
Well, they get the money on the glamorous drugs that you
Thank
see all
you.
the commercials on TV
The
for.
Viagra. Yeah, exactly. Take the purple pill. Yes.
Yeah, exactly.
Yeah. So they don't make much money on antibiotics. They don't make much money on antivirals. Okay. So, and I'm just throwing ballpark figures out there, but let's say in 2000, they spent $1 million. They gave drug company X $1 million for research, right? That doesn't go anywhere. Okay. COVID became a pandemic. Instead of giving $1 million, then they're giving $1 billion with a B ending in an S of money towards drug company X, Y, and Z. And then plus President Trump, he kind of wanted people to share proprietary information.
So it kind of lifted some of the protections in place.
Yes, some of the patents went by the wayside.
Gotcha.
And basically what they had to tell each other is, well, this didn't work, so don't do that, right? So, $1 billion is going to get you more researchers. It's going to get you more growth media.
Opens doors.
Yes.
Yeah.
Yes, absolutely. More people, you're going to be working around the clock with that, right? I would be. Somebody give me $1 billion. I could do a lot of things with that.
Sure, absolutely.
So that's one of the things that actually helped push that forward.
Sure.
Why we got it in a period of months instead of years.
Think of the United States World War II effort. Once we entered the war, car plants switch over to tank plants and things. That basically the resource had shifted to priority one, getting us ready for that. And in essence, in the medical world, priority shifted. Priority one, find a vaccine for COVID.
You're absolutely correct.
Gotcha. Very good.
And then also, I think that we're facing just a lack of information when it comes to COVID and poor information. I deleted my Facebook account. I used to have a Facebook account because I like to get in touch with some of the people I went to high school with.
That was probably better for your mental health.
Yeah, because every time I read anything there, it was wrong.
Well, that's what makes me mad. It's not that it's out there; it's that people believe it. I'm like, because I don't know. I just remember and I don't know if this is information and technology and the way we get it now. It's just when we were younger, if it looked ridiculous, sounded ridiculous, we just chalked it up as ridiculous and moved on. Now, people give more credibility to some of this stuff, and it just infuriates me. I'm like, come on, be common sense. I know, and then people say it's not common anymore and all that, but common sense with some education, and you're going to be just fine. And that's do that.
No, I agree. I
didn't want to get on a soapbox, but this is something that
it's important.
I feel like the answer is easy, but we get so muddy in all the details that we forget the end game sometimes and what we're trying to do here. And I get it. We all get polarized on this and politics and everything else. And when it comes to your health, at the end of the day, the people you should be listening to are the same people you've been listening to about your health before politics got into the question here. That's just my opinion on this. But y'all do you, but that's my opinion on this.
Interesting statistic. 90 to 95% of all medical doctors, MDs, have been vaccinated.
So it tells you, as a whole, the consensus are that they support it. Now, not like you said, it's evolving, and this is where I think this is where people get mad, and you need to understand. And I think this is where you need to come from a place of understanding, where education will help you. Yeah, because the world is so muddy with information that some of it's good, some bad. The way we get it, but like you said at the beginning here, this is something that's brand new that we're coming. So anytime, look at any other achievement we've done in history. Do you think we just showed up on the moon one day? No, we didn't. There was a whole thing of, and you look at the vaccines we take today, your polio, your smallpox, all these others, the mumps, measles, all these things. These are all things that we don't even talk about anymore, and they're just almost an ancillary. Oh yeah, remember that was bad, and then we don't.
Yep.
But it wasn't overnight before they said, guess what? We cured polio, or we got a vaccine now. It takes time and testing, and unfortunately, when it comes to a pandemic where people are dying, you're going to peel back behind the curtain and see how the sausage is made a little bit, because that's the only way we can quickly get to this stuff. But as they're learning and evolving, it's like, oh yeah, we think we nailed it. But now this new variant or new wrinkle comes in, and that kind of changes the way it does things. None of that's political. That's just science doing science. And we need to understand the difference between politicians telling us stuff and just where the science is taking people. And I think, am I on base? What you're talking about?
You're absolutely 100% correct. And in a couple of the other things that I would say, trust me when I say this, I didn't come of this opinion overnight.
Yeah.
When COVID was really going strong, we're going to take you back to probably last December, January. I myself, as a primary care provider, family practice, have to sign things like death certificates. That's part of my job, unfortunately.
Yeah.
Normally, I sign one once every 6 months, maybe sometimes once a year. During COVID, during the first 2 weeks of January, every single day there was at least one, and there was one day that I had to sign to 3.
That's unfortunate.
So, back when this first began, 2 to 3 hours every single night before I went to bed. I read every night before I fall asleep. Every single night I was reading information on the vaccine, the virus, everything. I didn't just decide, hey, I'm going to put this in my body haphazardly.
Sure.
I don't know a single doctor that did. We all read about it because we practice evidence-based medicine.
Well, and I think you got into medicine for a reason.
Yes.
And this is exactly part of that, and why are we not listening to the people that this is what they do?
Right.
This is, to me, that's, and I know I'm getting soapboxy. It's just, I don't understand why people are making a big convoluted thing. It's like, what does your doctor tell you? Do what he or she says. That's what you should do. When you get something on your arm and you're like, what's this thing? And the doctor says, do this. You do that. Why would you not do that for this? So, and if you disagree, then get a second opinion. Talk to another doctor. See what they say. That's in America. That's how it works.
Absolutely.
And that's how it should work. And the onus is on you and your family to make sure you take care of these things. We as a society, we want to help you and all that, but you got to reach out. You've got to do this stuff. And if you don't, you're really handcuffing yourself and your family here. So if you have questions about COVID, and
ask your doctor.
Ask, if you don't have a doctor, I'll tell you right now, I'll get you all the information here. You can schedule an appointment with Dr. Jewell here and sit down and get that done here. But let's do this. Now, obviously, if you're dealing with any other problems besides COVID, if you need physicals for the family or women's health or counseling, health, nutrition, diet, when you get, generally speaking, if you get diabetes diagnosis, odds are pretty good it's usually your primary care doctor that gives you the first indicator on that. And in essence is your first exposure to information and resources on how to mitigate it. Then you probably will talk to an expert in the field to give you more information things. But when it comes to the day-to-day stuff, Dr. Jewell's your guy to help you navigate through that type of stuff.
Absolutely. We help diagnose diabetes. Sometimes, actually quite a few times, I treat it as well too, because I also have type 1 diabetes. I've been a diabetic for 42 years now.
Okay. So you
walk the walk.
You
talk the
personally have experience on how to deal with this.
Yes.
Disease. Now, generally, you probably deal with more type 2 than type 1.
Yeah. It's because, not to use pandemic and epidemic, but diabetes is an epidemic. And they estimate 15 to 20% of the New Mexican population has diabetes, and about 10 to 12% of that, actually it's higher than that. I think it's 60 to 70% of that don't know that they have it.
Interesting. I have a theory.
Go ahead.
I know it's another left field thing, but I'm curious. Like, you're a medical expert. I'm wondering if my theory has any kind of weight to it. I wonder if food technology has altered some of the numbers in diabetics. And what I mean by that is food's way more convenient now in how you cook it and eat it and get access to it. Where back in the day, you had to use fresh produce and fresh ingredients because that's all there was. There wasn't boxes of things and stuff. I think the 50s you really started to start seeing the packaged food things and all this. I think there's something going on there. I think the way that they're making these foods and the way they're doing this for preservation and packaging purposes are, in essence, putting us down a path for seeing more diabetes and these types of things. I know it's about decisions, and people are like, no, you go and eat a McDonald's hamburger every day. Guess what? That's going to be bad. But a lot of times you buy things thinking, oh, I got a box of potatoes or whatever it is, and then it's really loaded with preservatives, things that, in essence, could be. Am I warm or am I way off base on this?
No, I think you are warm, at least partially, because there's a lot of factors that go into diabetes in the epidemic these days. Yes, I do believe that it's part of the way that we process foods these days. I think it's the amount of sugar that we have in food today. Sugar's in everything, including ketchup. We use high fructose corn syrup now instead of sugar. High fructose corn syrup, in some cases, not in every case, but in some cases, it's almost like sugar on steroids.
Gotcha.
So
it's like super.
Yeah. A lot of studies show that it's addictive too.
Yeah.
So
I can see that.
Yeah. And what do we do as soon as we get home every day? We flip on the TV and change the channel.
Sure.
We're not as active.
We sit on our butts a lot.
We're not as active as we used to be. I mean, taking or thinking back to my childhood, I mean, 90% of the people that I knew in the town that I grew up, either worked in farming or construction. I mean, and let's face it, farms are becoming conglomerates.
Yeah.
So you've got this big corporation, less people working there.
I don't know a lot of farmers that go to the gym to work out because they don't need to.
They don't have, yeah, exactly.
They get their workout at work.
Yeah. And then there's less and less people that are working the construction fields too.
Sure.
So you're not as physically active as we used to be as a society. So
Sure.
I think that's
Comes
also
into play.
part of the there's a lot of reasons why.
So again,
diabetes is.
technology again, just not necessarily food, just ease of doing things and things. So yeah, we almost have to, and I also would think too, medicines come to big play. We probably had people that had diabetes and just couldn't diagnose it back then because we didn't know any better.
Yes,
that comes into play too. It's not, I say it like, the technology caused diabetes. No, we got better at finding it too. But I would say it certainly has helped or helped in getting people less educated about their foods. I think we traded convenience for education on some of that, and now we just got to find the happy medium and learn to balance it and learn. And it's with diabetes, it's dealing with diabetes. I don't care if it's type 1 or type 2. It's all about the routine and establishing the habits and patterns. And if you can get that in the right way, then diabetes is very, very manageable.
Absolutely.
It's when you've got to break the cycles, break the habits of eating ice cream at 2 a.m. or instead of eating a sandwich, you eat 4 sandwiches. You know what I mean? That's the kind of stuff you've got to change in your habits to help. And that's where your time with Dr. Jewell here, you're a partner in that. And it's like
Absolutely.
saying, because especially if you're going the medicine route to treat some of these, if you get to that point, it's a constant changing battle. Your body changes and its reaction to the medicines. It may be working perfect for you now, but 5 years from now, your body's chemistry changes and it's not going to work as well. So we got to come up with a different plan. And if you're not on top of that and you're just like, oh, I got my pills, I'm good to go, I'll see you in 20 years. You're not doing yourself the service. So it's so important, especially if you're dealing with conditions that require like diabetes or any of asthma, anything that's like a chronological thing that you have to kind of stay on top of. Please do not ignore those things. If you don't want to go to Dr. Jewell, go to some doctor, but please go to a doctor and have a primary care physician or have that family doctor set up in your family that you can go and make sure these things, because taking care of these now and doing the simple things, it's going to save you so much headache and quality of life. I mean, you're going to have a better quality of life later down the road. And you got to find that balance because, I get it. You don't want to eat rabbit food your whole life and say, well, great, I lived to 100, but I ate rabbit food my whole life. I get that. But you got to find the balance, moderation. Eat your steak every once in a while, but don't eat it every meal for every day. Let's find alternatives. But that's the kind of stuff that's it's very important to have a relationship with a primary care physician. And Dr. Jewell, like I said, you've been here, you've got the experience, and if you really, especially like if you're on the fence about this COVID, please bring those. If you're seeing ridiculousness on Facebook and you're really considering that, talk to Dr. Jewell or talk to an expert first before you preach that as gospel. That's doing more damage right now than I think anything else is people thinking legitimately that information out there that just sounds ridiculous is true. And that's what scares me most about all this COVID more than anything else. I mean, I've been vaccinated and I got COVID, but it was a bad cold for me. And I'm pretty sure if I did not get vaccinated, I would have been in much worse shape. I'm diabetic too. I'm a type 2 guy and I deal with that. So I'm one of those lowered immune risks type as well. So I know. So I went and got the shots as soon as I was able to and do all that. But make that decision for you and your family based off good information, not off what you heard on Facebook or what the guy on Fox News or CNN said to do. So
you made a real important point when you were talking about how you had gotten COVID.
Mm-hmm.
You'd been vaccinated, so it was like a minor cold,
Mm-hmm.
and that's about 90% of what we're seeing with patients that have been vaccinated.
Mm-hmm.
If they get sick, it's very mild symptoms.
Yeah.
If they don't get their vaccine, I have a couple of family members, two people actually that were in the ICU, both people on ventilators, and one of the people, close family member of mine, his girlfriend passed away.
Oh man.
Also had COVID on a ventilator, just like that. So it's affected my family as well too.
So you're seeing firsthand the results too, not just patients, but
exactly.
personally. So
Exactly. Yes, sir.
So please ask the questions. Don't whatever decisions you make, I respect because it's your life and your decision. But please make it based on good information. Don't make it off of rumors or hearsay or people that aren't qualified to make those statements to you. Make those statements. Go talk to people like Dr. Jewell that went to school a long time and constantly study this stuff and do it day in and day out. This is what they do for a living, and I don't know. My brain, I'm like, why would you trust somebody else? I
like that. Yep.
I mean, like, let me when you go to get your oil changed and you go down to the Jiffy Lube or whatever, get your oil changed, and that guy starts telling you about getting colonoscopies, are you going to believe him? Or, is that a good idea? No different than if you go to Dr. Jewell here and he starts telling you how to time your transmission. I'm like, Dr. Jewell, I respect you, but I don't think you know what you're talking about here.
That's for sure. I don't know how to set a timing chain. That's
my point here. You know what I'm saying? So please schedule an appointment, give him a call. Of course, your office is just right up the street, right across. These are bad landmarks, but that's the landmarks. Right across from Wendy's and Cattle Bear and all those fast food places.
Yes, sir.
When you're in between meals, come by his office right up here, right by the new car wash there.
You can get lunch and then get treated for diabetes.
Exactly. There you go, coming and going. But make an appointment. You can call his office direct at 575-627-4200. And if you click option 2, that'll take you right to Dr. Jewell's, your receptionist
office.
there,
Yes,
your
sir.
office there.
Makes it much easier with that option.
And schedule appointment things. And also, too, if you don't remember any of this, if you go to Lovelace's, just type in Lovelace online and go to their website, find a doctor, Dr. Jewell, you'll pop up, you'll see his information right there. So if you're driving around or whatever, you can't write this down, you'll find it there at the Lovelace's website. Or just come on by the office and say, hey, I'd like your appointment when you got available, and they'll do it face-to-face, no problem.
I just started seeing patients today.
Good.
Or I will be as soon as we're done here. Had to get computer training. It's a whole new system. And
yeah, you got to learn it's kind of like, DJs. I know do it radio, but then I come in here and it's like, what's this button do now? I got a new buttons to push. So.
Exactly. Yep. Technology is always evolving.
Absolutely. Doctor, is there anything you wanted to share that we just skipped on or we just got sidetracked on?
I could go a little bit over more of some of the other things I do, procedures. I do minor, like mole removals.
Okay.
And if you think you have a skin cancer, I can do something like a punch biopsy or at least evaluate it. I do, minor injections when it comes to things like, steroids.
Okay.
I do shoulder injections, knee injections, that kind of thing.
Excellent. And of course, if you're not feeling well, regardless, come see you.
Yeah, absolutely.
And he'll help you. He'll take care of you. He'll get you where either if he can't do it directly, then he sends you to one of the specialists that Lovelace has that can take care of those problems. But that's the family practice medicine. That's
yes, sir.
That's you know what? Think of the old school doc that come to the house with the bag. That's Dr. Jewell, except for he doesn't have to do house calls anymore.
Yeah, exactly. That's a whole malpractice thing. So yes.
Although, I mean, sometimes I kind of wish back in the days where the doc shows up with the bag is like, put some mud on that thing and you'd be fine. You know, I mean, there's a lot of good medicine coming.
I really wouldn't mind going house.
There's a lot of good medicine coming out of that. Just saying. So,
yes, sir.
Thank you, sir. Thank you for spending time with us today. And I know you're. I'm sure they're screaming to get you back to work here. So we do appreciate you spending a few minutes with us here.
Absolutely.
And anytime that you're able to come, love to have you chit chat. Maybe we can. Maybe after we get out of COVID, we can get you back and talk about some more.
I pray to God.
Healthcare
we need to get out of COVID.
I'm ready.
Whatever it takes.
I think you and many are ready. So, but thank you, sir. Appreciate it.
Yes, sir.
All right. It is 9.